Hi, my name is Joseph Irizarry, and I'm going to be going through an elbow evaluation video. I have my patient right here, and we're going to go through the steps of that. So, you go ahead and tell me your name.
My name's Ben.
Ben, how you doing, Ben?
I'm good. How about yourself?
Doing well. And what sport do you play, Ben?
I play golf.
You're a golfer? Okay.
Yes.
How long have you been playing golf, Ben?
Since I was like 5.
Since you were 5? Okay. So what brings you by today?
I've been, we're doing this tournament right now, and I've been having like some soreness, like numbing, tingling on my left hand.
Okay. And so, what is your dominant hand?
My dominant hand is my right hand.
Right hand. Okay. And so, you're in the middle of a tournament right now. Is it something that's been bothering you since the beginning of the tournament, or just start today?
Well, it's always been happening, but like not to like that, like it hurts a lot.
Mm-hmm.
And until now, like it feels like it's sore, and like I feel sometimes like it's when I hit, it's like it's numbing.
Okay. So it's been kind of lingering on for a while.
Yeah.
All right. And have you been, when you notice that bothers you, have you been doing anything, putting ice on your elbow, or taking any ibuprofen after you play around, or take a couple of practice swings?
No, it's just like I always warm up before, but then like and I never like expected it to be like this bad. I always like, brushed it off.
All right. And have you had any previous elbow injuries or any other injuries in general?
No.
No? Okay. That's good. All right. So would you mind going through and just kind of showing me a little practice swing, kind of just like look at the mechanics?
Okay. Yeah. So like I'm right-handed, so like as I would go swing and go in.
Okay. And is that kind of the way you've always swung a golf club, or have you ever made any adjustments to your swing at all?
Well, like as I got better, like playing more, swinging more, like I adjusted it, but like pretty much the same.
Okay. And and so is this? Are you towards the beginning of your season, middle of the season, end of the season?
Like towards the middle, right
Towards
now.
the middle.
Yeah.
Okay. And you guys play a tournament every week?
Like every depends. We just pretty much like go do a couple games, and we just had a tournament this week that we signed up not that long ago.
Okay, so in terms of how often you play, it's been relatively consistent.
Yeah.
Okay. I'm just looking to see if maybe it was maybe the beginning of the season and just started playing again. See if maybe something could be flaring up from the change in activity level there.
Okay.
Okay. Well, what I'm going to do is I'm going to do a little bit of palpation, kind of see what's going on.
That's fine.
I'm going to start with your shoulder and kind of work down, just because what I'm looking at is we have the kinetic chain, which means basically nothing in our body acts independently of anything else. So your elbow, you may not think the shoulder's going to be related to it, but if you have any soreness or any lingering pain in your shoulder, it could affect the elbow, could affect your mechanics, thus probably increasing the chance of an injury to the elbow.
Okay.
So I'm just going to kind of cover all the bases, make sure everything's okay.
Okay.
So I'm going to do a couple palpations. Is that all right?
That's fine.
Okay. So in the interest of time, we always like to compare bilaterally and test the unaffected side first. But for the sake of time in this video, we're going to go ahead and say that I've already tested his unaffected side and say that everything, range of motion, strength, and all that checks out just fine. So now I'm going to go to the affected side. So you've been having pain on your left elbow,
Yes.
right? Okay, so can you take one finger and point to where it's bothering you the most?
Right about right here.
Right about there.
And
Okay.
like all this side.
Okay. So I'm just going to start up towards here. Kind of go along the clavicle, work my way towards the shoulder and the AC joint. Any pain, discomfort when I do that?
No.
Any pain or discomfort when I go back here?
No.
Okay. Any pain or discomfort up in here?
Just like tender.
Just tender?
Yeah.
Okay. Anything here as I move down?
A little bit.
A little more as I get towards the site where it's bothering you the
Yeah.
most? Okay, so there's a little bit of pain, a little tenderness up in the shoulder towards the proximal portion. I will address that more when I get into my special tests, but now I'm going to move more towards the actual injury site. So, any pain on the outside at all?
No.
There?
Yeah, it feels tender, like
Tender?
yeah.
So on a scale of 1 to 10, how would you rate that pain?
I mean, in the beginning, it would feel like a 4 or 5, but then it kind of like gradually, like it would fluctuate.
Okay.
Like how much
So what would you say, what does it bother you the most? Does it bother you like in the middle of a round, or do you notice it the most when you're done shooting 18 holes?
It would probably be like in the beginning, and then like after a while, it would like go down.
Okay.
But then like a couple swings later, it would like
Okay.
randomly hurt.
All right. And does the pain stay in your elbow, or does it go to the shoulder? Does it go to your hand and wrist?
It goes to like my hand, and like all pain. It feels like it's numbing. Like it goes all the way down to like my hand.
Okay, and when you kind of feel that numbing sensation, how long would you say that lasts for?
Like a couple seconds.
Okay.
Until like I have to like move around and do something like.
Okay, so it kind of feels. Would you describe it as kind of that pain where you like maybe you falls asleep, kind of that thing where it's got pins and needles?
Yeah, when it's kind of like tingling.
Okay,
Yeah.
that's fine. All right, so I'm just going to do a couple things real quick. Go ahead and stick your arm out like this, and go ahead and put your other arm out as well.
Okay.
And I want you to close your eyes for me. Keep both of your arms like this.
Okay.
Do you feel this?
Yes.
Do you feel it evenly on both sides?
Yes.
Any abnormal sensations?
No. No.
No?
No.
Okay. Do you feel this?
Yeah.
Do you feel evenly on both sides?
I feel it more on my left side.
Okay. Any abnormal sensations?
No, not really.
Okay. All right, go ahead and open your eyes. Now I'm just going to do a couple of muscle tests real quick.
Okay.
So go ahead and put your, go ahead and extend your wrists and keep your shoulders bent. So what you're going to do is you're going to go from here and do a bicep curl. And just go through that motion real quick for me, just to get so you're used to it.
Okay.
All right, how's that feel? Pain, discomfort?
A little bit.
A little bit?
Yeah.
Okay. So now we're going to do the same thing, but I'm just going to guide you through it, and then we're going to do it again. I'm going to provide a little bit of persistence. Does that sound okay?
Yeah.
Okay. So put your hands in that position. How's that feel?
And still kind of like a little bit.
Any
not
different,
as much.
any different than when you did it by yourself?
No, not as much.
Okay. All right, so we're going to do it again, and I'm just going to place my hand here, and you're just going to go against my resistance, okay? So I'm going to go ahead, and we're going to say that I tested these unaffected side, and that his strength is fine. So we're going to go ahead and do this side now, so go ahead and go. Okay, good. How'd that feel?
It like kind of hurt.
Kind of hurt a little bit? Okay. And when you felt that pain, show me with one finger where you felt it the most.
Right here on this.
Okay, so in the same area.
Yeah.
Okay, good. All right, so the next thing we're going to do is I'm going to have you extend your fingers out, kind of spread your fingers apart.
Okay.
And so what I'm going to do is I'm going to try to squeeze your fingers together. I want you to the best of your ability, prevent me from squeezing your fingers together, okay?
Okay.
And go. Okay. And we'll go ahead and test the side. And go. All right. So that was fine. Those are good. So what I'm looking for there is I did some dermatomes and myotomes, checking sensation because the patient complained of numbness and a little bit of loss of sensation distally. I wanted to make sure that that checks out. There's a little bit of a lack of sensation, but nothing too bad. Strength is good, which is what we like to see. So I'm just going to make sure that everything else is fine, that there's nothing else that's being impeded. Okay. All right, that's all good. So now I'm going to jump into a few more special tests, kind of looking more at the elbow, just to make sure, kind of whittle down my diagnosis. But what I'm thinking about right now is medial epicondylitis, which is AKA golfer's elbow. Also, what could be happening is impingement of the ulnar nerve, which is causing the little bit of loss of sensation, some numbing things going on like that. So I'm just going to go through a couple more tests real quick. Is that okay?
Yeah.
Okay. So I want you to stick your arm out for me, just kind of a little bit of a flex position. So what I'm going to do is I'm just going to apply a valgus force. So all I'm going to do is I'm going to put my hand at the wrist, cut my arm around the lateral aspect of the elbow, and I'm just going to kind of push in. How's that feel? Pain, discomfort?
It feels like discomforting, yeah.
Okay.
Like it hurts.
So I'm putting a little bit of a valgus force on the elbow to kind of mimic the mechanism of injury, and I'm looking for joint laxity or any pain, tenderness with that. On the unaffected side, there was no laxity and no pain. On the affected side, there was a tiny bit of laxity and some tenderness as well. So go through a couple more things. Go ahead and stick your arm out kind of like this, kind of extend it out. And you're just going to do a straight bicep curl for me, okay? So go ahead and just practice that. Okay, and now I'm going to guide you through it.
Okay.
And then we're going to go against my resistance, okay? Go ahead and go. All right, good. Pain, discomfort with any of those?
Yeah, it just like feels like when I come in this way,
Okay.
That's when I start feeling it the most.
All right, and of the 3 that we did, which one bothered you the most? Was it when I helped you through it, when you went against resistance, or when you did it by yourself?
When you pushed on it.
Okay.
Pushed down on my arm.
All right, so when I provided resistance, that was a little bit painful as well. So go ahead and stick your arm out like this. And so I'm going to put him in a neutral position, and now what I'm going to be checking is pronation and supination, that rotational movement around the elbow. See how that feels for him. So you're going to start from here, and the first movement we're going to do is pronation, which all I'm going to have you do is you're going to turn your palm of your wrist to the floor.
Okay.
Okay, and just go ahead and practice that motion. Okay, and I'm going to take you through it. Any pain or discomfort with that?
No.
Okay, now you're going to go do the same thing, you're going to against resistance, okay?
Okay.
How'd that feel?
Not so much.
Okay, not so bad. All right, so now we're going to do basically the same thing. We're going to go from this position, but now you're going to turn palm up,
Okay.
which is we're going to check supination here, okay? So go ahead and practice that movement for me. And how's that feel?
Kind of hurts.
Kind of hurts a little bit?
Not that much.
Okay, so go ahead and we're going to walk you through the motion. How's it feel when I guide you through it?
Nothing.
Not too bad?
Yeah.
Okay. So now we're going to do the same thing. You're just going to go against my resistance. All right, how's that feel?
A little bit.
A little bit of pain, a little discomfort there? Okay. So we walked through some special tests. I went through a couple of basic motions with him. And his range of motion is good. The strength is a little bit off compared to his unaffected side, but there's not a huge drop off there. I'd say it's probably about 85% of the unaffected side, which is good. But what I think we're looking at here is medial epicondylitis, which is golfer's elbow. One of the things that could be leading to this is it could be something along the kinetic chain, shoulder, like scapular stability issues, things like that, where the muscles acting on your shoulder blade, maybe they're a little bit weak, maybe they're just something where it's you haven't worked them out or exercised them or strengthened them lately, and now all of a sudden you're pushing yourself in competition because you want to do well, you're forcing your body to do things that to maybe go on its limits a little bit. So what I'm thinking could be going on is maybe a little bit of weakness or stability issues up top of the shoulder are working their way down through the mechanics of his swing, thus causing the improper mechanics to cause an overuse injury of medial epicondylitis in the elbow. So there also could be a little bit of entrapment of the ulnar nerve, which is causing a little bit of sensation loss. But the strength is good. He has distal pulse, distal circulation, everything there is good. So everything looks fine, but I think we're looking at a simple issue of an overuse injury there. So what I want him to do is I'm going to give him a functional measurement outcome, a little bit of a survey, where he will go over his symptoms, his activity level, things like that, answer kind of where his pain level is at and everything else, and he'll give that to me, and we will take that into account in terms of looking at his short-term and long-term goals. But what I want to do with him is I will have him come see me. We will work on some scapular exercises, and I will also work on some forearm and upper arm exercises as well, because we don't want to neglect anything else to cause any other injury. So we will look at shoulder, bicep, tricep, forearm, and looking at strengthening all of those, getting range of motion to be where it's equal, strength is equal, so that way he can just continue to start to have that go away over time. And as of right now, immediate treatment, you're just going to ice it. And so after you get done taking your round, doing your warm-ups, whatever you have to do, because you're during your final round of the tournament. So in the meantime, over the weekend, just put some ice on it, and 20 minutes of ice on for every hour, then take it off for the other 40 minutes, and then just kind of continually icing it throughout the night, because there's a little bit of irritation in there, a little bit of swelling as well, but palpation is a little bit of point tenderness. So the ice will help get rid of some of that pain. If you feel that with the ice you have any more loss of sensation or issues with that, take the ice off immediately and let me know, and we'll go from there. But the biggest thing right now is we're going to ice it, we're going to rest it after your tournament's over, but we're going to look at strengthening the shoulder and the arm, both the upper arm and the forearm, to help prevent any further injuries of this in the future. So that's going to be what we do. Just make sure you ice it, rest it when you're done. That's my elbow evaluation video. Thank you.